Gordon Christensen. May I share with you for a few moments some startling information concerning a form of cancer that has had less publicity than many other types. Oral cancer is common, and it can be a terrible disease. Its detection falls within the realm of dental professionals. Why is that? Dentists and their staff see most patients on a 6-month basis, which is far more frequently than they are observed by any other health professionals. Detection and treatment of oral cancer is an opportunity to save a life. Let's look at some of the little-known facts about oral cancer. You may think these are exaggerated. They're not. About 36,540 Americans will be diagnosed with cancer of the oral cavity and pharynx in a typical 12-month period. During the same time, 7,880 of them will die of oral cancer. And 1 American, this is shocking, dies of oral cancer almost every hour. It claims more victims than cervical, skin, or testicular cancer. There has not been a decline over the last 30 years, despite a significant reduction in smoking, a known causative factor of oral cancer. Why is that? There is a proven link between oral cancer and the human papillomavirus, or HPV, which is largely transmitted through sexual contact. Oral cancer is usually detected far too late for conservative treatment, which causes the following dismal statistics. I know you've seen some oral cancers that were huge. It's too late. When discovered in the late stages, the 5-year survival rate is only 30%. But when discovered in the early stages, the survival rate can be 80 or 90%. As a prosthodontist, I have treated many oral cancer patients. After devastating disfiguring surgeries, you have seen them, including prosthetic replacement of the nose, the eyes, part of the face, the maxilla, the mandible, and other facial parts. If the dental profession will increase discovery of oral cancer in its precancerous stages or in the early stages of progress, there will be a profound positive influence on the victims of the disease. Such early detection will save lives, as well as reduce the terrible disfiguring effects of oral cancer and the potential reduction in masticatory effectiveness, speech, taste, and the resultant pain and inconvenience. What can we in the dental profession do to discover oral cancer in its precancerous or early stages? We are the logical and most equipped profession to take on this responsibility. Take it. We have more knowledge and experience in the oral area than any other health professions, and we see patients very frequently. Many dentists and hygienists have long been providing regular visual oral cancer exams using conventional operating lights and manual palpation of the face and neck for suspicious lumps. However, many dental professionals do not provide such exams. I strongly encourage each of us to accomplish these simple, fast, visual, and palpation cancer exams on every periodic recare appointment. I've done them at every 6-month time. I've discovered a lot of cancers over the years. Additionally, I suggest that each of us should augment our conventional exams with the use of an adjunctive screening device, such as the VELscope system. Such devices assist each clinician to find lesions that may not be apparent to the naked eye. The exam requires only a minute or two, is non-invasive, and it may be covered by benefit programs using the code ADA-D0431. If a practitioner has a cancer screening fee of only $15 to $25, the concept can be not only a major appreciated service to patients, but a significant revenue source for practices. You may feel uncomfortable informing patients about the presence of oral cancer. Keep in mind that the suspicious lesions you detect will be biopsied, either by you or another person, to determine the exact characteristics of the lesion, and then analyzed by an oral pathologist before any final decision can be made. That person will be the one to inform you and the patient about the state of the suspicious lesion. In the patient's mind, you will be the person who detected the lesion. I have one lady who comes in every 6 months that we detected cancer on years ago, she actually cries when she comes in and looks at me. And that's been at least 10 years ago. Saved her life. I've had many patients express their gratitude for my discovery of an oral cancerous lesion, leading to conservative therapy and continued life. Those practitioners and researchers using oral cancer detection devices have also found other oral diseases, including viral, fungal, and bacterial infections, inflammation from various sources, including lichen planus and other lichenoid reactions, squamous papillomas, salivary gland tumors, and others. You know as well as I, these discoveries provide even more reasons for these exams. In my long career to date, I have observed an obvious and positive evolution in patient attitudes about dentists. They now expect you and me to be responsible not only for their dentition, but for any related aspects of systemic health. You're the one. Nobody else is looking there very thoroughly. What is more important and what is a more serious challenge than oral cancer? Why not incorporate a thorough cancer screening concept into our practices? In-depth cancer screening provides a genuine opportunity to potentially make a major difference in the lives of our patients. It's time to do it.